A vasectomy merely blocks the vas deferens tubing, which is the anatomy that delivers sperm from the testicle to the outside world. We make an incision in the scrotum. It's a very simple procedure in the office, and we divide that tube. Most of the time we'll burn the edges and put a little titanium clip across it to make sure that the tube is completely blocked and permanently so. That keeps the sperm from being able to get out, and certainly that's the mechanism by which the birth control works. When a man has a vasectomy, people frequently wonder, is it going to change anything else? Their sexual response is unchanged. The ejaculation is the same, semen still comes out. The ejaculation and pleasure orgasm is all the same. The erections are the same. There's no real change in the physiology except for the fact that there's no sperm coming out and mixing with the ejaculate. So that's how the birth control works. The risk of failure of a vasectomy is about 1 in 100,000. And obviously people are doing this for permanent, reliable birth control. Well, that's pretty reliable. The only thing that's more reliable than a vasectomy is abstinence and never having sex again. Most men are clearly not going to choose that. When a vasectomy does fail, it's usually related to sperm still being in the tubing, and that usually happens early on when a man just fails to let the system flush out. Sperm live in those tubes, and until they have a chance to flush out, it's still very possible to get pregnant. Plenty of people have gotten pregnant 2 weeks after a vasectomy. So we advise people, do not rely on vasectomy as a form of birth control until we have checked a semen analysis, usually about 6 weeks after the procedure, to make sure all the sperm have flushed clear. Then it's reliable to use. The other possibility is that the tubes could grow back together. It's exceedingly rare, and it might happen at any point down the line, that those tubes would just happen to line up next to one another and try to grow back together, a process we call recanalization. But it's exceedingly rare. We use a technique that's dividing it, burning it, and clipping it to keep that from having a possibility. So it's a very reliable process. Yeah, so a vasectomy is a very safe outpatient procedure. We perform most vasectomies right in the office. We give people either a tablet of Valium about an hour before they come in or a shot of a mild sedative while we're there to relax them. Then we numb the skin up and do the procedure. It can be done in the surgery center under anesthesia. A lot of people feel squeamish about having a procedure done in the office, and if they do so, then we'll set it up under anesthesia where you can drift off to la-la land for a few minutes while we do the procedure. I'm sympathetic to this. I faint every time they draw my blood, so I know that the anxiety level about the procedure sometimes is bothersome, but most people are perfectly comfortable right in the office. The horror stories that people hear about vasectomies are urban legends blown wildly out of proportion. When we numb the skin up, people are perfectly comfortable, and we can get you done with a vasectomy, and a very safe procedure. So a vasectomy is a safe, simple procedure to perform in the office. There are a few conditions that we would want to know about before performing it in the office, just to make sure they wouldn't interfere with the ease of the procedure. If you'd had previous scrotal surgery or scrotal injuries, any type of hernia repairs, or other issues that you've dealt with scrotal pain or things of that nature, we'd want to know about that so that we could examine you and make sure that the vasectomy wouldn't interfere or aggravate those problems. Men that have cardiovascular disease or other things where they may be taking blood thinners or anticoagulants, we'd want to know about that, because we would stop those blood thinners about a week before the procedure to minimize any chances of unnecessary bleeding and swelling that might result. Those are just the associated medical problems that might cause us to schedule the vasectomy in a slightly different fashion or what have you. Yeah, so the vasectomy we perform right in the office. Obviously, the vas deferens are the tubes that deliver the sperm from the testicle to the outside world. We make a small incision in the skin of the scrotum after we numb it up. In the old days, a vasectomy, or snip procedure as people would refer to it, would commonly have an instrument like this where we would snip the vasectomy. However, nowadays we have much more refined instruments. They're tiny, delicate, and we're able to use tiny little needles to numb the skin up, and very careful, meticulous dissection to identify the tubing. We find the little vas deferens tube. There's one on the right and one on the left. Typically we can find them through the same little incision, and then divide that tube, cauterize the edges, and clip it. It returns to the tissue where it normally lives, and then we put a few stitches in the skin. Overall, it's a 15-20 minute procedure, and well tolerated in the office or the surgery center setting. The main thing people need to know about their recovery from a vasectomy is once we perform the procedure in the office, we're going to put a little ice pack on it and send you home with some pain medication. We want you to go home, get in an easy chair, comfortable, prop your feet up, watch television, take it easy. The thing that catches men off guard is they're expecting it to be really painful and hurting a lot, and when they get home and it's not, they feel like they're free to go do whatever they want to. That's where the problems start. So even if you feel perfectly normal the day after a vasectomy, you need to plan to sit around the house, prop your feet up, and take it easy. This is not the time to do the spring cleaning or go play basketball with your buddies. Take it easy and let it have a chance to heal up. If you're into sports or athletics, you need to try to mark off a couple of weeks of doing those types of strenuous things, but you'll be able to casually get up and move around, do casual things, go sit in a restaurant, watch a movie. However, we don't want you doing sports or athletics or really strenuous things. The example I always use is if you load planes at FedEx for a living, you're going to have to take a week off just because it's too strenuous. However, your work is casual and leisurely and you don't have to do anything really strenuous. You'll be able to go back to work to any type of desk work, phone, computer, anything of that nature without any real problems. Vasectomy has very few complications. Obviously, it's designed to create a permanent state of birth control. Any type of surgery on the testicle, it's possible that it could damage the testicle or its blood supply. Chronic testicular pain is something that will show up on the websites when you do a search. However, it is very rare. Less than 1% of people will have any type of long-term pain related to a vasectomy, but it is possible. There were some studies that had raised a question as to the possibility of a vasectomy increasing your risk for prostate cancer. Hundreds of studies have been done since then that don't show any added risk, and certainly at this point we don't recommend any additional screening for future prostate cancer concerns just on the basis of having had a vasectomy. Other than that, a vasectomy doesn't affect any of the physiology. It doesn't change your testosterone levels. It doesn't change your libido. It just makes you sterile.